the next talk would be by Dr. Nirmal Fredrick, a present president TNOE. He's going to talk about how do you uh, see, record the autoclaving process, how do you audit the process, and how do you manage the book which has records of the entire autoclaving process. Over to you, Dr. Nirmal.
Thank you, Dr. Kumaran, and thank AOS and team for inviting me here. So this talk would have been better after hearing Kumaran's talk about the sterilization aspect and the validation aspect. Nevertheless, I'd be concentrating more on the auditing and documentation of sterilization. So there are two parts to it, the sterilization aspect. One is the machine aspect. The second is the process aspect. So usually the process aspect is done by our staff, and most of us, we won't be in the picture. And if something happens, as long as it goes positively, no issues. But if something happens, then we are more bothered about this auditing and documentation aspect. So it's very important that we not only train our staff to do the process well, but also important to ask them to document the process. So how do we do that? So we do that with the help of various registers and documents for sterilization, and so I have no financial interest to declare. So basically there are many formats, but there are certain standard formats available with vendors. You can use that. So there are many methods available. All we need to do is each load, we have to know the details of the load, the sterilization load, the number of packs, the content, what is the content inside that pack, what type of instruments we have, and what are all the concern, whether it's a liquid or solid. Then temperature, what level did the temperature went up and how long it was there in that temperature, and what was the pressure and time record chart. So all these are important parameters. So all your basic documents need to capture this. The second part is whether it is physical or steam based autoclave, or if you are doing a chemical thing like ETO, so you have to document that. Then whether how frequently you do that, whether it's daily, weekly, and there are certain tests that has to be done weekly. I think Dr. Kumara will be covering more about that. So basically in eye centers, we need to have a standard operating procedure for autoclaving and the entire sterilization disinfection process. This standard operating procedure have to be defined by the hospital. So it would vary with as per the hospital policy, but it has to be based on national, state, and international guidelines. And there are certain standards for the hospital infection HIC standards that have to be followed. So the standard operating procedure has to what all indicator used in the hospital, when to use it and how to use it. So this not only has to be there as part of the training, but also it has to be there in the policy, and this aspect has to be documented and audited. You also need to define the responsibility. So who is responsible for that particular process? If somebody is operating a class B autoclave, who is responsible for that machine, who is responsible for doing that process and documenting the process, and who will oversee the process. There has to be a supervisor in to oversee the process. And if you are going to use biological indicators and certain water culture, so those things have to be documented. The third aspect is auditing. So all these are done by our staff. Most of the time the doctors won't be available. So this process has to be audited. So this can be done by a supervisory team, or in case of NABH accredited hospital, there will be a hospital infection control committee and OT in charge. So they will be doing the auditing process. So the biological indicators, there has to be a timeline for using these indicators. So ideal is to use this once a week or more frequently. Of course, depends on your the volume of operations and the number of loads you do. You need to keep all original reports in the operation theatre and the hospital infection control committee department. So maintain the collection date and results in a Excel or a manual register. So this is the general format. For steam, we use the Stewart Haemophilus biological indicator, and ETO we use a B atrophosis indicator. So these are there are various methods of doing. I'm sure Dr. Kumaran will be elaborating on that. Bovidic test is basically used before starting the autoclave to ensure that the machine is working well and the process is going through, and the results are maintained in the register. So many of the newer machines give a printout that can be stuck to the register. Then process control test have to be used every day before loading the instrument, and so again this is manual or electronic printouts would come. You need to maintain that in the registers. So it can be so this is the type of sterilization monitoring register, and all these are available with the vendors. Anand Enterprises is one vendor who gives all this registers. Autoclave register is a mandatory statutory documentation needed for as far as sterilization is concerned. So if there is an issue, you need to hand over this mandatory documentation to the authorities. So you have to record details of every cycle as well as the load content and everything, and what indicator we are using. So class 5 and class 6 integrator are the ideal indicators to use here. And you also need to list out the autoclave parameters, which program you are going to use. There are multiple programs, particularly in automated machine. There are at least 5 to 7 programs, and some machines have 13 programs. So whatever program you are using, you have to mention that. And if you are going to use ETO, record details of every cycle, the load details and the ETO indicator being used. You also need to use the cartridge you are going to use, the details of the cartridge and the expiry date of the cartridge. Since ETO is a chemical, it has to be discarded properly. So where you are discarding the cartridge, all those things also have to be recorded. So this is the ETO sterilization register. So you have to record all these parameters, and again, so the new and automated machines have all this in a printout. And if you are going to store the autoclaved items, so ideal to have in a proper sterile storage area. It has to be well lit, the temperature have to be maintained, the surface have to be clear, it should not be dusty, it should not be humid. All these parameters have to be monitored if you are going to store. The storage instruction, if it is linen based, ideal is to use it as frequently as possible, so not more than 2 or 3 days. But if it is a packed one, Tylene pack or any other appropriate packages, you can store it as per your policy. You can store it up to 30 days or 90 days or 180 days as per your hospital policy and the storage mechanism involved. So this is autoclave issue register. So which theatre the sterilized items are going to be used, all those things have to be monitored. And this is again a ETO issue register. ETO is usually done once in a week or once in 2 weeks or once in a month. So we need to have a proper storage register, and where it is issued and which theatre or patient the instruments were used. Then something about the microbiology. The air culture is once a month, even though in laminar airflow theatre we don't advise air culture. So for certain documentation, air culture is needed. Active air sampling, ideal to use the settle plate method and get the microbiology report done. So usually it is more for microbiological monitoring of the entire process. And this is the air sampling done for AHU. And water, this is very, very important. The water you use has to be monitored properly. It's better to, if you are going to monitor, so weekly monitoring of the water used in the instrument wash area, and in the scrub area, ideal monthly. Again, this depends on the volume of operations, and if it's a potable water, you need to test the water at least every 3 months. And OT sampling, generally we don't advocate on a regular basis. It all depends on the hospital policy. But it has to be done before commissioning a operation theatre or recommissioning a operation theatre after a prolonged time, or if there is any construction. So the take-home message is more than doing the process, documenting is very, very important for two aspects. One is the regular auditing and training purpose. Second is the medical legal aspect. If there is untoward events like endophthalmitis or cluster endophthalmitis, these are the records that will save you in the court of law. So you need to have proper documentation. Basically, since the staff are handling this, make it a very simple record or register, make it manual or EMR based. Record every aspect of sterilization and monitor them daily or at least weekly. See whether all data are filled up properly, and then audit them over a period of time, every month or every fortnight or every 3 months. So the auditing period also have to be defined. So any questions, I'll be happy to take. Thank you so much for your patient hearing.
It's a wonderful presentation, Dr. Nirmal Fredrick, sir. Can I have a question, please? For the benefit of the audience, how frequently should doctors check the record and sign it?
Okay, ideal is to check every day, end of the theatre. So before signing off from the theatre, you need to check all the documents and sign it. So if the moment you go out, staff may forget, or so they are left to them. So they will go for a coffee and forget to record. So it's always better the surgeon who's in charge of theatre, when he goes out, signs all the documents, see to that everything is filled up.
Thank you so much, sir. Actually, that's the answer which I wanted you to say. Thank you.
Thank you.
Being Sir's junior, that is one thing I've noticed him do day in, day out. Every day, Sir ends his OT by ensuring that every document that is pertaining to that particular OT is signed and the quality is ensured. So starting from the autoclave indicator, Sir makes it a point to personally verify them before he exits the OT. So I think it's going to be a very good example for us to follow. Thank you, sir.